All right, folks, thanks everybody for joining. We're gonna get started in 1-2 more minutes. Just hang in tight. I'm pulling up some music to hold everybody over, but we're gonna get started in just a minute. Some stragglers jumping on. All right, Deb, you want to get started? I want to be mindful of folks' time and let's see. Oh, Debbie, you're muted.
Okay, there I go. All right, folks, I just wanted to say good evening and thanks for hopping on the call tonight. In CWA, we have had a very, very busy couple of years at the bargaining table. I can tell by looking at the names of the folks that are here that you have been very busy. So I appreciate the time you're taking to get on the call tonight. As many of you are aware, we have been working to have something done legislatively on safe staffing for decades. And finally, in June of 2021, we had the legislation passed on the Clinical Staffing Committee. And while it wasn't everything we were looking for at the time, it has turned out to be a significant and wonderful step towards getting the staffing ratios that we all deserve, and hoping to improve the conditions that folks are working under. And I think in the 17 months since the law has been implemented, the work that you've been doing on the clinical staffing committees is to be commended. And I know that several folks have also used the legislation as a mechanism for getting some additional language and contracts related to staffing. So a lot of hard work has been done already, and we're still a couple months short of the implementation. So thank you for everything that you're doing. Folks are really doing a great job. I just want everybody to realize that this is incredibly important work that you're doing right now. As some of you know and may have experienced, Haney's, Greater New York, and many of the hospitals in the state are still reluctant to work with us on concepts around safe staffing and patient to caregiver ratio. So even once the ratios go into effect in January, we are still going to have to be diligent in working on the clinical staffing committees and really enforcing the ratios that we have, making sure that all of the facilities live up to the commitment they've made to us. So there is enough work for everyone to do. We welcome your participation, and I am looking forward to working with each of you as we continue to move towards this goal of safe staffing in all of our facilities. So what I'm going to do right now is turn the agenda over to Hannah, and she's going to do a little bit of a review on the law and what it does for us. Hannah?
Yes, thanks so much, Debbie. For anyone who I haven't met, I'm actually pretty new with the union. I started just a couple of months ago, and my whole job is this staffing committee stuff, which for me is really, really, really exciting. And hopefully for you, it is as well. So I want to just kind of start by giving you an overview of the law, because I think there may be some folks who are not familiar with the law and what it does. So with this clinical staffing committee law that was passed in 2021, each hospital now has a permanent staffing committee that has both frontline healthcare workers like you, and it's chosen by the union and by your peers, and it also has management representatives on that committee. Every year, the committee negotiates a staffing plan that establishes staffing minimums for all direct care titles on each unit and each shift. It also requires that the plans must specify how many patients a worker can be assigned at one time. And that's big, right? But talking about staffing and what staffing should be is one thing, but in order for this law to make a meaningful difference in the staffing in our hospitals, we need to enforce the plans that the committees come up with. And the way that we're doing that is the law allows the Department of Health to investigate and impose serious penalties against any hospital that violates the entire process by either failing to form a staffing committee or a staffing plan in the way that the law requires them to. There are very specific requirements of how that process should go, and it's designed in a way that is fair for both management and for us. And once those plans are in effect, the Department of Health can investigate and impose penalties if the hospitals do not follow the plans, and if they refuse to respond and resolve violations that we report. That's just a basic overview of the law. I mean, there's a lot of moving parts in it, so I'm happy to chat with anyone if you have specific questions. But now I'm going to turn it over to Becca, who has really overseen the first phases of this law and that implementation, and she's going to tell you how that went.
All right. Hi, everybody. So good to see so many faces on the screen that I have loved working with to do this really important work. So, right, we passed this law in 2021, and one of the tricky things about this piece of legislation is that it has a phased implementation. So different pieces of the law become in effect at different times. So in January 2021, the requirement was that each hospital had to have a working committee. We did that. Most of you hopefully know about the committees at your facilities and who's there and who's on it, but it's a committee at each hospital across the state, union and non-union. So that happened. Next piece was that we worked for about 6 months from January to July to negotiate and submit staffing plans. Those plans had to be submitted to the Department of Health, and that happened. So many of you know that each hospital at this point should have a staffing plan. So the first thing I want to do is make sure everybody knows where to find your staffing plan, because if you don't know what the staffing plan is for your hospital, you should definitely start taking a look. So there's two places. One is current and one is forthcoming. So the first place is you can go to the Department of Health website, and all staffing plans for every single hospital is listed there. You click on your facility and you can pull up the plan. The downside to this is that they are not in a consistent format. They are not required to be in any type of consistent way that you could compare them. This is definitely not ideal. So one of the things that Hannah has been doing since she joined us at CWA is going through each of our facilities plans and putting them in a format where we can actually compare. So we have a safe staffing website that will be launched imminently in the next few weeks. So stay tuned for that. And on that website are going to be all of our plans in a format that is definitely easier to read than what you would see on the Department of Health website, but also in a way that we could compare. So what are the ratios that we're seeing at the ICUs in one facility versus somewhere else? And if they are different, how can we use that information the next time we're at the table, either bargaining or the staffing committee, to get a better ratio for everybody. So the goal here is to increase transparency as much as possible so that we can fight for better ratios and for better care team configurations to improve the quality of our patient care and workplace conditions. All right, so we created these plans, we created these committees, and it's been an interesting process and we've learned a lot. So the first thing that I think, I see a lot of people on here who've been intimately involved in this process. The first thing definitely was not unexpected, but we saw hospitals explicitly not following the law. So the law said something and then they did something else. Some examples, we saw at some facilities, hospital management trying to deny committee members the right to serve on the committee on paid time. That is illegal. That is something that was explicitly said in the law you can't do, and we saw that happen, right? Or try to happen. We saw hospitals in some facilities trying to choose who was on the labor side, also something you're not allowed to do, and it says so in the law. Refusing to meet and develop the plans in good faith, canceling meetings, pushing them off, that kind of thing. We also saw them trying to not account for all the factors that are required in the law. So for example, one of the factors that the law requires is for staffing plans to take into account the ability to do meal breaks, which is completely reasonable and foreseeable. And some plans did not take that into account. So these are ways in which hospitals have already been violating the law. Every case of this that we know of, we are challenging with the Department of Health to get some real enforcement on. Next piece,
Yep.
Anna.
Sorry.
Thank you. No, you're fine. The next thing we've also seen is a little bit more of a gray area. We have seen hospitals trying to narrow the implementation of the law. So, in the last thing I was just saying, we have a case where hospital management is actually not following the law that is written there. You can't deny it, right? But then there are some things that, there's a reason we have courts to interpret the law. And in this interpretation, they have tried to narrow the scope. And this is a big problem for us, because this is really where we need to fight hard to make sure that we're getting an implementation that respects the full scope of the law and the way that it was intended to be implemented. So some examples of this that we've seen are refusing to allow union representation in the committee rooms, or excluding specific job titles. The law was written to take into account the full care team. So when we have some titles that we represent that should be at the table and they're saying, oh no, those titles don't count, they can't be in this room, that's a big problem for us. We also have some exclusion of departments and units that should be included. The language of the law says that we need to have plans for all patient care. Hospitals have interpreted this to say that that doesn't include procedure rooms. I've even seen, arguments around the emergency room department. These are obviously all places where it's not explicit in the law, but there was an intention, and we need to fight for that intention to be real. We've also just seen some hospitals, like I said, not, operating in good faith and just unilaterally making plans. These are all things we saw. We also saw mixed engagement from the Department of Health. Like I said, every single time there's been a violation or a narrowing of the law, we have filed complaints with the Department of Health. The Department of Health is currently staffing up. They are actually hiring to deal with all the complaints that have been coming in and to oversee the implementation of this law. So, I just want to be clear. I think we have seen a Department of Health that's engaged, like easy to get on the phone, but we haven't seen the action that we need to follow through there. So it's a little bit of a mixed bag in terms of how the Department of Health has been operating. I think we've had good open lines of communication, but we haven't seen the action that we need. I'm hopeful that that's going to happen very shortly, very soon. So a little bit of a mixed bag there. We also saw a lot of good things, right? We saw members really being able to fight for their patients and their coworkers, and in a way that was fruitful. There were a lot of facilities where we got really great ratios. We got really great staffing plans, and that was due to the hard work, dedication, commitment, blood, sweat, and tears of our members. So this gave us a platform to have more frontline healthcare workers actually at the table making decisions about what staffing should look like in their units because they are the experts. And that was in a lot of ways really fruitful and well respected. So we had some facilities where management and labor really worked well together to create something that was good for workers and good for patients. And in places where even if we didn't reach consensus, there was also a lot of places where workers were able to have their voices and their concerns heard. They were able to have a forum to bring these things up. So even if we didn't reach the end goal that we wanted, we were able to actually engage on the issues. And in many places, that's a huge step forward. And then finally, yeah, we won some amazing ratios. I mean, there are a lot of staffing plans out there that require excellent staffing. And so, in that way, that was a huge win. And now it turns to another phase around enforcement, which is really what this call is about. And then, of course, as Debbie mentioned, we were able to use this law in order to make real wins at the bargaining table. We saw some incredible contract work happening over the last 2 years, and it's been really, really amazing to see the interplay of this legislation and bargaining and how we can use both to win out for our members and for patients. So some lessons we're taking away is that this law does allow us to fight and in many cases win ratios and good ratios. And it allows us to make wins at the bargaining table, to win hard at the bargaining table. However, we have already seen an aggressive management especially from the associations in the attempt to narrow and in some cases explicitly not follow the law. So we knew this. The hospitals are not going to enforce this themselves. They are not going to call themselves out when they miss a staffing plan or a ratio that they were supposed to hit. So really it is up to us to enforce it. One of the main challenges of this law is that the implementation relies on you. And that's hard. That adds something else to your plate. So it is up to us to enforce it. We also learned that how this law is going to work is being decided now. I mentioned that some units have been excluded. So there's nothing in the law that explicitly lists all the units that have to have staffing plans. So we think at the union that there's one interpretation, which includes all places where patient care takes place. And there's the hospital's interpretation, which is really a limited set of inpatient units. So no one's made a final decision. The Department of Health hasn't said anything. The state hasn't said anything. So it's still a fight. And so we are in that fight right now, trying to figure out how this law is going to be implemented, what's going to be included. And we need to be pushing that boundary so that we are holding the line on the intention of this law, which is to improve staffing. That's the heart of this. And that is what we are trying to do. All right. So we created committees. We worked on plans. We submitted those to the DOH. Now we're working on enforcing the violations that we've already seen. Hannah's doing an amazing job analyzing all those plans so we can pull some takeaways of like what we saw in different places. We will share that with you when we have that. And we're looking forward to January 1st when all of these plans will finally be in effect. So right now we have all those plans, but none of them are actually in effect. On January 1st, that changes. On January 1st, the hospitals have to implement the staffing plan, and it is our job on January 1st to start enforcing it. So the next part and the main part of this presentation is really going to be sharing with you all what we're enforcing, how we're enforcing, and with who's doing it. All right, so enforcement. We are calling this our Step Up to Staff Up campaign. Step up to staff up, right? Really exciting. A lot of work to be done. What we need to do, there's a lot of work. There's 3 main things. All members need to be able to monitor the staffing on their units. The second thing is that we need to submit staffing data to the union. The union is going to be collecting staffing data. So we're monitoring the staffing, and then we're submitting data on that staffing. And the third thing is when there are violations of the staffing plan, when the staffing in your unit is not what it should be, is not what the plan says it should be, when you're short-staffed or something's unsafe, something like that, when the plan is being violated, filing a complaint. So we're going to talk a little bit more about these things. All right, staffing data collection. Why? We need to collect our own data because we cannot rely on management submitted data to track staffing in our facilities. As we've mentioned, they will not hold themselves accountable. So the staffing data is going to go towards a few things. It's going to be critical in our process of actually enforcing and investigating and pursuing with the Department of Health our complaints. And ensuring real enforcement. It's also going to help us better understand on a statewide level what we should be bargaining for, what we should be looking for in the committee process, and what we should be asking for with Albany. You know, we went to Albany for decades and said, we want mandated ratios. This is what we want. We wanted them in the law. And we ended up with this compromise proposal. And now they're going to look over the next 4 years to see what happened with this proposal. What did it do? Did it improve staffing? We need to be able to say whether it did or not. I think, you know, there's a real, in the law baked in is an assessment of whether the law works. And to work, it has to actually improve staffing. And so we need to be able to say whether that happened or not. And if we rely on management's data, then we won't really have a good sense of if it's reflecting the experience of our members on the ground. For example, using payroll data, which is what management will have to submit, will average out staffing, which could really change the picture versus what you're experiencing on the ground. If you spend an hour or two of your shift being completely short-staffed, but they end up somehow being able to average the numbers, that might not be reflected in their data, but it could be reflected in ours. So it is really, really, really important that we are constantly reporting on what the staffing looks like on your units, and we're creating a really easy, dare I say, fun way to do it. The other thing we need to be doing is filing complaints. These are two sides of the same coin. It's going to be the same form. The first part of it is going to be submitting the data, and the rest of it will, if you fill it out further, will lead to an official complaint. So the first thing to know is that any member can file a complaint. Actually, any patient, any worker can file a complaint saying, you know, this is not safe. And the staffing committees at each hospital are tasked with responding to those complaints. They can resolve them, they can dismiss them, or they can kick them up to the DOH. And any complaint kicked up to the Department of Health by law must be investigated. And if they find it to be a real violation, they are able to levy a fine of up to $5,000 per violation. This complaint process is where our power is as the union. This is where we have actual room to hold our hospitals accountable. So the DOH must investigate any unresolved complaint and can levy penalties up to $5,000 per violation. So when there is short staffing on your units, we should be filing complaints. Our staffing committee should be fielding those complaints and kicking up to the DOH when we have a problem. And then, as you know, Debbie and Hannah and I will be working with the DOH to ensure real enforcement and fines where it's appropriate.
Great.
So before I hand it over to Hannah, I'll just say that the data and the enforcement with complaints are all part of the job of everyone here. And we have multiple ways that we're going to be going about this. So Hannah's going to talk about how we're going to submit those data pieces, how we're going to submit complaints, and who, what kind of structures will we have in the union to do this. So Hannah, take it away.
Yeah, awesome. So really awesome news. And Becca mentioned it, but I'm going to go a little bit more in depth. We are publishing a website with a lot of really, really important information, like your the staffing plans for your floors and contact us and upcoming events and everything. But primarily, it's the home to both the data collection form and the complaint form. Becca did touch on it, but with the form, you'll fill in your basic information about your job and the staffing levels on your unit. And then you'll have the ability to automatically file that formal complaint with your facilities staffing committee from that same form. So it's not going to be a heavy lift. And we're designing that because we know that a lot of times you're going to be filling out this form when you're short-staffed, right? So it's really important that we're going to make this as easy as possible for you and as streamlined as possible. However, I say all of this, but like I said, coming soon, not up yet, but really very, very shortly, we're going to be launching the website, and we'll be sending information out as soon as we do. So everyone will have the ability to file staffing data and the complaints, but we're now recruiting for a super, super, super important job. And that's for staffing captains. Staffing captains are really the main army behind enforcing this law. Anyone can be a staffing captain. I mean, any CWA member can be a staffing captain. But ideally, we're shooting to have at least one on every shift in every unit. But if multiple people say, I want to be a staffing captain, even though I work on the same unit as someone who's already a staffing captain, that's totally fine. That's even better, right? More information is better. So to be a staffing captain, this means that you would be regularly submitting data, utilizing the website that Becca and I just talked about. You would also be trained to be an expert on the law itself and the rights it gives you all as healthcare workers. And because of that training, you would be a really great resource for members on the law, on the staffing plans, and when filing complaints yourself or helping others file complaints. If that all sounds like something you'd want to do, go to cwa.org/staffing captain to sign up. It's also in the meeting chat, but if you're over the phone, I'll say it one more time, it's www.cwa.org/staffing captain. So I mentioned that you have to be trained, right, to be a staffing captain. You're required to go through, it's a paid one-day training to learn about everything I just talked about. We're now getting close to the deadline to get you off the schedule for this training because the first trainings are in December. So if you're planning on signing up, I'd encourage you to do so as soon as we get off the call so we can make sure that we can get you the time off to come to a training. As I said, in December, I'm doing 3 in-person trainings in New York, Buffalo, and Utica. And I'm doing a virtual option as well. And I'm also scheduling out some trainings in January if you can't make the Buffalo dates or you decide to become a staffing captain after your schedule is already posted. When you sign up on the form, it will ask you which training date you would like to attend or if you'd like to go to a January date instead. Again, that website's www.cwa.org/staffing captain. So we're getting to the end of this call. Our next steps. Number 1, sign up to be the staffing captain. The link's on the screen. I said it a couple times. It's in the chat. You can also text me or call me if you want the link. If that's not a good role for you personally, talk to your coworkers to see if they are ready to step up to be a leader in this. Number 2 on our list of next steps, the website's coming. And so is some other really, really exciting stuff. So just make sure to look out for your announcements as we launch all of this great stuff. And number 3, we got to be prepared to step up to staff up. The plans go into effect on January 1st. We really need to be ready to submit the staffing data. And when it's not what it should be, we need to be ready to file complaints and hit the ground running. Okay. That was a lot of information in a really short period of time. I think Becca and I are also fast talkers, so it might have been a lot. My contact information is on the screen for those of who are on Zoom. For those on the for those on the phone, my email address.
Out, Hannah,
oh yeah,
with everybody. We'll send everybody's contact information out by email to anybody who showed up today, so that everybody.
That's incredible that we can do that. See, I'm new. I'm learning new stuff every time. So we'll send that out. Just so everyone, don't ever hesitate to contact me for any reason at all on any of the staffing stuff. Like I said, it's my full-time job, so I am at your service. But for now, I do want to give Becca and Debbie an opportunity to say anything if you'd like, but otherwise I'd like to open it up for what questions does anyone have?
That's right. Let's get some questions if anybody has any. Make sure
that sounds good to me too.
And you are muted. How do you unmute when you're on the phone?
I will find out while we get our first question. I think I see Michelle unmuted. Michelle, do you want to go first?
Yeah, so Hannah, with the staffing captains and Becca, good to see you. The 15th and the 20th of December, I have commitments on those days, so I would have to do virtual, but what time would the virtual be? Is it an all day?
Yes. So all of the staffing captain trainings are from 9 a.m. to 5 p.m.
Okay,
virtual and in person.
okay, and it's the 15th and the 20th.
Yes, I'll go back to that slide just for anyone else who.
Yeah, and Michelle, the time might, we might end up doing something a little in there, but you should plan more or less a full day of training.
Okay,
And we'll give, might not be exactly 9 to 5, might be like 10 to 4, something like that. But yeah, you should plan a full day of training, and of course, a full shift of last time will be available for folks. And we'll just want to make sure we work with the locals to call people off.
okay. Very good, thank you.
Thanks, good to see you, Michelle.
You too.
Patty, I see your hand up.
Yes, I have so the plan that we have submitted, that's what the DOH is gonna go with. There's no, because ours was not agreed upon, so the CEO wrote her letter and her justification for why it was different.
Mhm.
So that's gonna be set in place. That's correct?
That's a really great question. Short answer, yes, it is set in place. The worst part about this law, in all honesty, is that if you do not reach consensus, the CEO has the final say. That is why our power lies in the complaint process. So every single time that you feel like there's a violation of the plan, or if you don't feel like the plan is meeting the needs and the intention of the law, we should be fighting it. And every single year, staffing plans are required to be to go through them again and resubmit. Like, it's not like this plan is for the next 10 years. This is for 1 year. If you add a new shift or a new unit, you have to create a new plan for that unit. If something changes in the facility, a new plan is required. If your committee wants to make any changes and you would get the CEO to agree at this point, that's the new plan. So it's never set in stone in the sense that you can't change it, but it is what is, in effect on January 1st, if no changes are made.
Right.
Why the complaint process and the enforcement process is so critical. And that's also why, if you have a plan right now that the CEO decided everything, you didn't reach consensus anywhere, that is not the intention of the law. In fact, there is language in the law that says if there is a pattern of not reaching consensus, the Department of Health must investigate. It says shall. They have to investigate. So what we've been doing is working with locals where that's the case. We do have some hospital facilities that have fought our members at every single step of the way, did not negotiate in good faith to protect patients, to protect workers, to do what is required by this law. And so when that is the case, we need to go to the Department of Health and say, this is what happened. It didn't work. They didn't negotiate. We didn't reach consensus. And there's a pattern here, right? They just unilaterally did what they wanted to do. And we
Right.
don't, as in line with what the law is requiring. And so win or lose, we're going to fight that battle. So I want to, Hannah's the one who's working to draft all these, complaints up. I'm working with the DOH to get some attention to them. They're apparently staffing and short staffed now. So, I think, unfortunately, that is the current plan. It sucks that you didn't reach consensus on anything that, management didn't take into account what they were supposed to, but we're going to fight that.
We didn't reach consensus on the staffing ratios. And then her justification was that, and it was, so I looked at some of the other hospitals in New York State and their plans.
Mhm.
And a lot of them, their day shift and their night shift I didn't look at a ton of them, but I didn't have that kind of time, but a lot of their staffing ratios, their day and their night shifts, their ratios were the same, where our CEO justified it by that nothing goes on the overnights. So that's how she justified putting, changing the ratios on nights. And she wrote that in a letter to our Department of Health.
Yeah,
So
that's ridiculous.
like, I guess the consent, honestly, I felt the whole thing with MVHS was like their plan, they gave us the plan and told us this is and then we all had to decide on ratios. Like we went back and we looked through it and we talked about it. We discussed it, but I really felt like they just pushed it on us.
So
Yeah.
Patty, I want to piggyback if I can. I'm
Yeah.
sorry for interrupting
Michelle?
anybody else, but I had the conversation with Hannah today because she listened in on our staffing committee meeting today.
Right.
And
I couldn't get on.
yeah, one of the people that were there said, well, we agreed. And I said, no, we didn't agree on those ratios.
Yeah.
And that our CNO prior to the one we have now, I think that was dumped in her lap. She was like so ready to get out of there and retire.
Right.
Here last, she submitted it. She did what she had to do, and that was it.
Yeah.
So I totally agree. And I said to Hannah today about the night shift that, back in the day, you had paper charting, you charted a few things here, but now it's like rounding every hour, computer, this, that, and the other thing. So whether you have patients are sleeping, not every patient is sleeping. Like I work in the nurse.
Her statement was so offensive. I can't even tell you.
I
So-
just want to highlight also like 1126, you all had one of the hardest processes that I saw in the state with a really uncooperative, uncollaborative, management towards
Yeah.
this. Like
They put us in a room and said, okay, well, we're done. We've done our part. We'll see you later. And they left like,
Yeah. I mean, it was,
you vote on it. Vote on
I
what?
just- yeah.
It was ridiculous.
I think just to kind of reinforce what Hannah and Becca have been saying, Michelle and Patty, the enforcement is going to be critical. And to take it a step further, if you have data and experiences that show that you are doing as much on the night shift and you are filling out unsafe staffing forms, that can go to the clinical staffing committees as well. So we should be meeting regularly, and we should be continuing to bring these issues to them. So even though a plan may have gone in for 2022, that
Right.
does not mean that we can't continue to pursue bad plans on a monthly basis at the table.
absolutely.
Okay.
So one thing today was, and I'm sorry to take everybody's time, and this will be my last thing, I promise, for the other 35 people on here, was the hospital has tasked the staffing committee with coming up like an assignment despite objection form.
Right.
Hannah was talking about, but I thought about that after, and I thought if we do that and it's electronically, does it automatically, we would have to work on it so that it automatically went to the union so we know something was filed. We would have to make sure that the hospital had it, because they were just saying that they were going to use that as a basis of saying, hey, well, they're shorthanded, on 2 East or whatever. But my question is if the person doesn't have time at that moment to fill out that assignment despite objection, then they can't say, well, they're going to come back and say, well, you didn't fill that out, so we didn't know you were short.
Yeah. I think the union, so I really appreciate this question, because just to clarify for everybody who's being asked by management to come up with a complaint process or anything like that, the union, we have a form that is nearly ready that we want to pilot with all of you to make sure it's the right form, but it is electronic and it will go to the local, it'll go to Hannah. So we will make sure that we address that, Michelle, because we want to, I think it's a little bit of a question of which pieces of information do we want to notify
Right.
management every time? Like how exactly do we want to let them into our data? And so that's a little bit of a question that we're working on and that we want all of your thoughts on. But ultimately this form will be online. Everybody is going to get like buttons with the QR code. So you could just like quickly scan it and put it in. You could text it. You could go to the website and put it in very quickly. You should be able to submit. You could do it later. You could do it, you don't have to do it the second it happens. So if there's ways that we want to deal with like kind of immediate urgent situations, we can think that through. But this is coming to everybody in the next few weeks. So, no need to kind of work on this on your own, because there's a lot of thought and work being put into it. And we're going to, I guess, roll it out to everybody and get feedback soon.
Okay.
Thanks, Michelle. Does anybody else have any questions? I want to also flag that if you're on the phone, you can mute or unmute by hitting *6.
And while you're doing that, there is a question in the chat, and the question is, how do we find out who is on the staffing committee? So I can answer part of that, and Becca might know the other part. That as soon as the website is launched, there will be a page where you can look up the members, the names of everyone who is on your staffing committees. In the meantime, I'm not sure if there's a centralized list. I'll let Becca chime in.
Yeah, I think in the meantime, the best thing to do would be to reach out to Hannah and get connected with your committee or anybody on the committee who can answer questions for you. So I don't know. I don't see it actually in the chat, but Hannah, if you want to just make sure that you give your contact information so that you guys can connect offline and get connected to the right people. Also, it's just important because committee members change, right? There's turnover, there's all these things. So always just make sure that if you need something, definitely flag Hannah, because she will be able to get you in touch with the right person.
Yes.
One quick question.
Yeah.
Can you hear me okay, Becca? Hi, everybody.
Hi, Anita.
Quick question. I just want to clarify, after we submitted all the counter rationales to the DOH, because we had so many violations and so many non-consensus, you did say that when they are investigating that, right, their final is not the final, correct? Because I heard like 2 parts.
They are investigating.
Okay.
What they have submitted, if there's no changes by January 1st, that is what will be in effect. But it's in contention, like, right, we're requiring the Department of Health to investigate. And I'll tell you that I have a meeting with them on Wednesday of this coming week to review kind of everything that's happened with the complaints so far. And I've done a little bit of, Hannah and I have been meeting with the other unions, like NISNA, 1199, all the other folks who are kind of participating in this process. And we're getting a real sense here that, I don't know, Hannah, would you agree with like 75% at least units or facilities are not meeting consensus? Yeah. And that to me makes me want to argue to the Department of Health that we need incredibly strong enforcement, right? Because the power, it's not working if that's what is happening. The goal of this law is for you to reach consensus.
Right. Yeah, I agree. But you know what they did do, though? I don't know if you realize this. I just want to make sure is that they kind of lowball the figures so there will not be a complaint. If you go by that, if they normally are staffed with, let's say, 4 PCTs are normally with 10, they made the numbers less. There's people currently in positions that they didn't put. So if you lowball everything, you're never going to be out of, what's the word I'm looking for? You're never going to be out of
compliance with the
right. Thank you, because everything has been lowballed.
To me, like that is something
that's bad faith.
Right. Yeah. No, I wrote it, but that's what was done.
Yeah. So I think we built in a lot of levers into the law that we can fight these things that aren't exactly like, just because the plan says you have to have 2 of this person and they have 2 of that person does not mean they are not in violation. It does not mean that. There are all kinds of ways that we have built into this law that we can fight. The task now is to fight as hard as we can to get the kind of enforcement that we deserve and that it was intended, and hold the hospitals accountable. And unfortunately, a lot of that relies on the Department of Health. A lot of that relies, on all of us to be really cognizant of what's going on and pay a lot of attention and do extra work. That's just the truth of it, right? But thanks, Lavita. I appreciate that. Did anybody else have a question?
I just had a quick question for you and Hannah, Becca, and it's on recruitment of people to be staffing captains. So if you, a local has a steward structure or a mobilization structure, can they approach those folks that are already in place and ask them if they're willing to do this work as well? Or are you looking for an individual who might say, you know, that this will be their only responsibility?
No, I can answer that. I think we're looking, if there are mobilizers that want to step up and do this, then absolutely 100%. And a lot of times the mobilizers are going to be like the extra great people for that role because they're already talking to all of the people on their floors. People already will go to them with questions about the union or something else. So I think that the mobilizers are especially great people for this role. And I know, I can tell you that I already have a couple mobilizers who have signed up for it. So definitely a really good fit. And mobilizers also, if you're on this call, we'd love to have you help, spread the word and sign others up as well.
Yeah. Stewards, mobilizer, I feel like all of you are already leaders in the union and on your floor. Absolutely. Absolutely. Our staffing captain program allows folks to get a better understanding of the details of the law, to really spend some time looking into their hospital staffing plan and thinking through the creative ways that we can enforce. Because as Levita just pointed out, if it's somewhat of like a yes or no, you might miss some of the violations, right? You might miss some of the things that we need to catch here. Like an example is that there are plans that don't take into account meal breaks, right? But the law requires meal breaks to be taken into account. So if you're staffed to the plan and that's not a violation, but nobody can take a meal break, we want to report that. So staffing captains need to be kind of attuned to these specific and somewhat sneaky ways in which hospitals are not following the plan. So that's what staffing captains will do. We will learn about all the sneaky ways. We will come up with more sneaky ways. We will think about, how we can spot it. We will think about retaliation. We will just make sure that we are being a little bit one step ahead, because our power is in the enforcement. Our power was not in the plan process. It is in the enforcement. Jennifer, I saw you unmuted. Do you have a question?
Yes, I just, what Jennifer were you talking to?
I guess maybe there are two. Sorry, maybe iPhone Jennifer, and then following that, the 716-574 number.
Okay. I was wondering, how is this any different than, like, for the past 10 years, I've been filling out ADOs and a lot of people on our floor. And the staffing situation has gotten abysmal right now. Like, we literally have one aide for 22, 23 patients and 3 nurses. Nothing has changed. It's gotten worse. Yeah. And they keep telling us, there are no nurses. There are no aides. What do you want us to do? And they're right, but there has to be an answer.
Yeah. So I think there are 3 ways, and Debbie, please feel free to jump in here. I think there are 3 ways that I would think about this. One main difference between like a protest of assignment form or any of the unsafe staffing forms is that these forms essentially will be immediately, if they are not resolved, will go to the Department of Health, and there's real enforcement mechanisms in the law. The law says that if the Department of Health does find the violation that is not resolved by the staffing committee, each time there is a violation, the first one is $2,500, the second is $5,000, and any complaint after that would be $5,000. That's a significant penalty. So if the Department of Health enforces the law as it is written, and as we are all intending to enforce it, then there would be a significant financial penalty for the hospital. And the excuse that they cannot find healthcare workers, that's actually also written into the law. It says that the inability to hire staff is insufficient as a reason why you are short-staffed. And part of the reason we put that language in is because, yes, there is a nationwide shortage of healthcare workers, but there's a lot of questions around what that really means, because simply a lot of people are leaving to go travel or, wherever where the pay is higher, right? And so the market conditions are not allowing, or the hospitals are not responding to the market, right? And I think another thing that's happening is that the working conditions are terrible. what you just said, is that staffing is abysmal. So we need to deal with staffing to retain healthcare workers. We need to deal with staffing to improve job conditions, to be able to recruit. And we need to work with, all of you amazing folks who just won these incredible contracts to be able to actually recruit and retain. So I see this as part of the solution to the staffing crisis, both in terms of shortage of healthcare workers, but also on the ground conditions. And then to your first point, I'll just reiterate that this is different because for the first time, there is real penalty if staffing plans aren't being followed. Those forms never had that penalty. I'll pass it to Debbie.
And the thing that I would add to that, Jennifer, and I can't say enough about the work that Becca and Hannah have been doing to make sure we're ready for January 1st. But for the first time, we are going to be able to track staffing complaints and violations and protest of assignment forms from every facility where we have healthcare workers, doing direct patient care. And so every time we go to Albany to talk to folks about staffing, we are going to have fresh, firsthand, relevant data that we can share with them in terms of what's going on in our facilities. So I know it is frustrating sometimes doing the protest of assignment forms, but it is more important than ever that we continue to do that. Long term, just because we have the legislation on the clinical staffing committee doesn't mean that there isn't legislative work that still needs to be done. And there is. And as you know, we have a great legislative team. When we were on strike at Mercy Hospital, Governor Hochul actually came to the bargaining table and made certain commitments to us about what she was going to do to correct the healthcare worker shortage in New York State. And everything that she talked to us about showed up in the 2022 budget. May have been small steps, but they were absolutely steps taken towards dealing with healthcare workforce issues. So we will stay on this, not just in the facilities, not just with the Department of Health, but in the legislative arena at all. So thank you for taking all those years to fill out the forms and keep up the good work.
That 716-574 number, I believe also named Jennifer.
Actually, this is Barb. I do have a question to see, excuse me. Has New York State identified what exactly a violation is going to be? Meaning, it's over a 24-hour period, if we had 10 units, during the day and 10 units at night that were not staffed properly according to our plans, there would be 20 violations potentially in a 24-hour period. Are they going to look at it as one violation because it's staffing issues, or are they going to be each individual?
That is such a great question. It, as we said a few times, the how this law is being interpreted is being decided now. The Department of Health has not released and said what will count. So the way that we are approaching is that each of those counts as a single violation, which is why the law can be so powerful. So the way that we are operating is under the intention of the law, which was that each violation is a violation. Each time that happens, that's a violation. And that's why the fear of the enforcement is so great, right? Because you multiply, what example did you just give? 20? You multiply that by $5,000, that's not, nothing, right? That's a lot. So that is why we need to work at this in a way that is expanding the bounds of the law. The hospitals are going to be going the other way, right? The hospitals are going to make the argument to the Department of Health that that's not even a violation, maybe one, right? They're going to be working on the opposite way. So it's undetermined at this point. The Department of Health has released, there's been all kinds of concerns that they haven't released guidance on. partially that may work in our favor, right? Because we don't want them to rule against us, but we have to keep fighting. And so right now we are operating on each one of those instances is a violation. We will treat it as such. We will fight for it as such and until something changes.
Great, thank you.
Yeah. Any other questions? There's one more in the chat. Does anybody else have anything before I answer that? Okay, so one question I got in the chat is like, what would be an example of a violation that would be resolved? So just to give an example, so the staffing committees are responsible for dealing with the complaints. So a complaint that would be resolved is if, for example, something was, people weren't being scheduled appropriately, but there was the staff there and they were able to schedule and fix it. Like if they were able to actually fix the staffing issue, whatever it is, then that would be a resolution of a violation. One that would be dismissed is if they found a complaint that didn't actually happen, right? If somebody submitted a complaint, but it wasn't real. And then something that was not resolved is that, a staffing violation is happening. The hospital has done nothing about it. And so we kick it up to the DOH for enforcement. Another question I had is, will the form be anonymous? Are you talking about the complaint form? Yes. No. And I think that's because, the complaints need to be dealt with and investigated. So there will be privacy around how the complaints operate, and it won't necessarily, like I said, we have to make a decision as a union of what information we will share with management. The complaints going to the committees don't necessarily, like there has to be a way to investigate them. So we have to be able to talk to the people who experienced it, but there will be privacy and protections. There are strict laws around retaliation, and there will be lots of protections from the law and the union. But no, they will not be anonymous. However, that doesn't necessarily mean that they're going to go, right to management. So we can definitely deal with whatever concerns come up that way. I also got a note that some nurses have heard in their hospital that the hospital is going to put a cap on violations. The idea, of course they say that, but that's why we're having this call. That's why we're setting up our enforcement. There's been a lot of management in hospitals that have just made unilateral decisions on how this law is going to work. And that is just not how this goes. So that is exactly why we need to be doing this work together. Any other questions, concerns people want to bring up? Hannah, Debbie, anything else to add?
Just want to say thank you to you and Hannah, the work that you've done, and the form that's going to be submitted electronically is huge. I think that's going to be great for our facility. The only concern I had, like I said, is having the hospital use it, and if the person doesn't get to do it that right minute, then they're they have a way of saying, oh well, you were we didn't know anything about your shortage, so I just want to make sure that gets addressed if that's what they truly want to do at our hospital.
Mm.
Thanks, Michelle. Deb, any?
No, I think we're good. Again, I want to just say what I said before. You and Hannah are doing a great job developing this program and this process for us. And it's going to be a lot of work, just like the enforcement of any contract or any law or any agreement is. But I know folks are up for it because, number one complaint in any facility when you ask about work conditions, it's a simple one-word response that encompasses a world of of problems, and that's staffing. And if you say staffing is bad to a healthcare worker, everybody understands what you mean. You don't have to say anything more than just that one word. So, you know, thank you to both Becca and Hannah, and thank you to everybody for getting on tonight. You know, the three of us are here. If there is anything we can do to help with recruitment of captains, getting folks registered for the class, the training session, anything at all, please just don't hesitate to reach out.
Awesome. Well, thanks everybody so much. Thanks for taking the time, and we made it just an hour. Awesome. Enjoy your-
Perfect.
Thank you,
Thank
ladies.
you all.
Thank you
Thank
so
you.
much.
Thank you so much.
Thanks, everybody.
Thank you.
Take care. So nice to see
Thank you.
Lavita, you're at work, huh? You're doing this right in the ER? Is that where you are?
Yes, I am. I'm in the PACU.
In the PACU, okay.
Yeah, actually my shift is ending in the next 30 minutes. I'm 8:30 to 9 p. So I'm about to leave.
Okay.
Yeah, yeah.
Well, I'll finish up and get home.
Yes, yes. Goodbye,
Take
everybody.
care.
All right,
Bye,
bye.
everybody.
Bye, everybody.
Bye.